Newsmaker show. This segment we have St. James CEO Bryan O'Donovan, Dr. John Robshaw, and Dr. Ismail Mehr. Everyone, thank you for calling in this morning.
Morning.
Well, I wanted to start out with Dr. Robshaw. Recently, St. James made an announcement saying with the doctors, and they said, don't be afraid to come into the ER. You're not going to catch COVID-19. Wondering, how are things going in the ER? Are you seeing the patients who should be coming in, Dr. Robshaw?
Yes, indeed, Brian. Good morning. We seem to be seeing a little uptick in patients who are coming in, and we're doing our level best to reassure them from the front door inwards with our universal mask policy and our social distancing policy, which continues within the department, that we can, whatever they come in with, that we can keep them protected from anybody that may even have the COVID. Needless to say, patients who are coming to see us, who we know we have advance warning, who are high risk of having or are known to have the COVID virus, they are totally separated from the rest of the emergency room population without prejudice, and they are dealt with efficiently in areas of isolation. We have plenty of rooms in this new emergency room with wooden doors on, not just the drapes that were the feature in the old emergency room up at Canisteo Street. So, yes, we're seeing more business in a good way, but we could always accommodate more. 24/7, we will help the community. If you are sick, come and see us. If you are not sure what to do, you can give us a call at 607-247-2323, and we'll give you advice over the phone and encourage you in if it seems appropriate.
Dr. Ismail Mehr, next question for you. Testing shows less cases in the Hornell area, but there are still some these days. Am I correct?
Yeah, that's my understanding. I've been following, we give daily reports, a dashboard that comes out, so which is what we wanted to see, right? From all this social distancing and whatnot, we wanted to sort of basically see no further community spread within the area. The nursing homes did have some cases, but that's obviously a little bit different than what we call community spread, because those are confined, small spaces. But we're seeing a decline all across, so I think that's good. I think that's what we're seeing in the state. I think that falls in with the president's plan, a phased plan of reopening as well. So I think, I know there's a lot of cabin fever, and a lot of people are really frustrated now, and a lot of conspiracy theories and a lot of this and that starting to happen. But I think we're getting there towards where the goal that we wanted to accomplish, and I think further updates will be coming mid-month from the governor on how things are going. And that's one of the reasons why, what Dr. Robshaw was sharing specifically, is why we felt comfortable moving forward, opening up elective things at the hospital. It's because of the declining numbers that we've seen in the area, so that allows us to be effective and efficient and safe for everyone who's coming to the hospital that may have chosen in the past not to come.
That's St. James Hospital CEO Bryan O'Donovan. Canisteo Street location question. In the beginning, it appeared that it might be that patients, COVID-19 patients, because there were so many weeks ago in Rochester and elsewhere, that the Canisteo Street old hospital location might be used for something like that. At the moment, what is going on at the Canisteo Street location, the old hospital location? What are you using that facility for at the moment?
Sure. So let me go back. So the epidemiological initial projections were to have this peak, this exponential model that we have talked about previously, which means that all of these tests would come to, would peak almost at the same time. That's clearly not the case. We're more looking at a linear model. So we have had conversations initially. We had inquiries which were then sent to Trinity Health. As of this past Friday, the old hospital is no longer part of St. James Hospital. That hospital and the keys have been turned over specifically to Trinity Health. So we have no relationship with that hospital any longer, with the physical plant structure. Now, if we ever needed that hospital, or if it was determined that we need a site for self-quarantine, that kind of thing, then the communication would happen between Trinity, Department of Health, and more than likely St. James, in terms of if they were looking how to staff it and those types of things. But, you know, as we've seen, Javits Center is a great example on a much larger scale. These field hospitals are really the way to go because they're wide open, and you can also, you know, bring in your own clinical equipment rather than try to retrofit something that you're only going to use for 3 to 6 months, and that hospital has some quite old infrastructure.
Back to Dr. John Robshaw, the ER head here. We got a statement from you, was it last week, I believe, that you have a new couple of doctors in the ER and a new nursing head there in the ER. Did you want to talk about that for a moment?
Sure. Let me start with the physicians. At the beginning of April, we were joined by Dr. Patrick Dackel. He's from West Philly. And a couple of weeks after that, Dr. Taras Gulianic. Both obviously U.S.-trained physicians, emergency room specialist physicians, both young and dynamic, like I used to be, but they are a really good fit here. They're just nice people. We're off to a good start if you can start with a nice guy. And they have decent medical knowledge, too, broad-ranging, residency-trained emergency room physicians, and we're just gently easing them into the Hornell way of things. They both come from city-based practices, and we're moving them into the smaller town, smaller city, I should say, mindset, and get them organized to practice efficiently in St. James here in Hornell. Our new nurse manager is Amy Smith. She was most recently, I believe she's a resident of Addison, but most recently working at Ithaca in the emergency room there. Came with great references and is very much found her feet already. And she is getting our nursing staff organized for the new facility. Lots of changes, everything happened at once. New nurse manager, new facility, but everything seems to be coming aligned, and we are looking forward to the prospect of our census being built up over the next few weeks as people come see us, and we will provide the best, most efficient care that we can in this wonderful facility that we have now.
Okay, back to Dr. Ismail Mehr, the COVID-19 team that you run, Dr. Mehr, with things winding down. Well, we hope so anyway. We think so, but are there more waves to come or the possibility of more COVID to come back? Does your team discuss that, and what do you think on that topic?
So, I mean, we have the team, and the team that I sort of lead is when we have to do anything that's very critical care related. So we step up to what we call similar to like an ICU level of care, and we haven't had that need in I'd say about at least 2 weeks. But I work with the hospitalists here. We, as you know, we have 2 new hospitalists. They've been wonderful, and they got thrown into a pandemic when we started the new building as the rest of us. So I'm in touch with them daily if they have any needs to manage patients. We still have COVID patients in the hospital, a limited number of them compared to 3-4 weeks ago, but they're very stable, and you know, many of them have been being discharged home without requiring critical care. In terms of second waves and whatnot, it's all possible. It's very hard to predict what's going to happen. I mean, the virus is not going to just vanish. At least we don't think it is, and it hasn't shown that it's going to just fall off the face of the earth. So as things start opening back up, there will be pockets and cases locally, possibly, but around the country, around the state. But I think this time around, on a national level, the containment plan is going to be much better, because now we know, as physicians, as healthcare facilities, as the Department of Health, the White House, you name it, we have an understanding of what needs to be done and not be hit, sort of not, I wouldn't say not prepared, but not prepared for a pandemic, right? So I don't expect an epidemic to hit the country. I would just think there'll be some pockets here and there as things start reopening, and it's something we'll be dealing with. There might be containment in certain parts of the country at times, and certain parts not. Hopefully we stay free from it. But if the need arises, we're here. We know what to do. We've been through this, and we can take care of it. And I'd also say this pandemic and the critical care aspect of things that we faced, it really was, it's also prepared us for moving forward here at St. James. We had newer nursing staff, some younger nurses, new doctors, new things. As you know, the old hospital did not have the ICU any longer. This hospital does not have an ICU, but we have a step-up ability to take care of more critical ill patients. And I know that's one of the concerns the community has had in the past, was that we weren't doing critical care type level at times in the old facility. That was just due to the structure and the setup that, you know, with the changes that took place over the years. So I think, you know, we're going to be able to do a lot of this stuff, and we'll be doing it as we continue through the new facility, with the pandemic or not, in terms of the care that we can provide. So, you know, definitely this helped us really, really get the teams in order to provide that step-up level of care, which I think, you know, we've done an exceptional job of doing that.
Absolutely. Back to St. James CEO Bryan O'Donovan. The elective procedures are pretty much all back now at St. James, and is that a good feeling to have your new hospital being able to do those once again, which you were not able to at one point here in the last few weeks because of COVID-19?
Yeah, no, it's a good. We're feeling good about things. You know, our job as healthcare providers here in the community, we have a responsibility in the community, is to prepare for the worst and hope for the best, and that's what we did. And now the hope part is coming through. You know, the best parts or the better parts of this whole thing are starting to come through. But the preparations that were put into place to prepare for the worst paid dividends. I mean, we were prepared for, I think, a chaotic type of environment, very similar to New York City, in terms of all our meetings and planning and behind the scenes. We were ready for using 125% of this hospital capacity and being able to do everything that you've been reading about and seeing in New York City and Detroit and other places. So again, we prepared for the best, or I'm sorry, prepared for the worst and hope for the best, and we're getting to the better parts now.
Sure thing. We're talking with Dr. Ismail Mehr, Dr. John Robshaw, and St. James CEO Bryan O'Donovan. This question is for either of the two doctors. Testing positive again after you've tested positive for it once, that's something that the Steuben County Public Health Department has raised in their press releases that they've seen. What are you seeing as far as that goes?
I think we've had some of our cases that we've sent out testing coming back positive, 3 of them, to be very honest. I think it all depends. I don't have the details in front of me, is the timing of those retesting as well. You know, this virus is unlike anything else that Dr. Robshaw and I have seen or read about. You know, we're not 100% sure. We thought viral shedding is 2 weeks, but there's been people who've tested positive 37, 38 days after infection. So maybe the viral shedding is longer. Viral shedding means the length of time that the virus remains in the system and is still portraying itself in the active form. It may not be causing the disease and symptoms any longer, but it's still present there and being released, you know, so to speak. So I think there's a lot of uncertainty there, and that's what the scientists and the researchers in the big fancy labs are trying to figure out. You know, this thing has really... There's been blood clots seen with this. There's been people who have stroked because of COVID-19. There's new cases coming out. I think Dr. Robshaw probably has been reading as well of things in pediatrics like Kawasaki syndrome have come out with this. I mean, it's just amazing. This virus does a lot of different things, and that's what's been the difficult part of it. So to answer your question, retesting positive. We've seen it locally, we've heard it nationally and worldwide. It might just be the viral shedding. Again, the big question is there immunity or not, right? That's what comes into this, right? If you tested positive again, or is it a reinfection or not? And those things, I think, will be figured out as the dust settles. You just can't figure those things out in the midst of a pandemic. Though it's downsloping nationally, you still have to get through this and then be able to take all the data from all the major metropolitan hospitals and centers around the country, and then I'm sure the CDC and the NIH will sit down and analyze data and then be able to model what this virus actually does and doesn't do.
Dr. Ismail Mehr with us here on AM 1480 WLEA Hornell, and also we started out with Dr. John Robshaw and St. James CEO Bryan O'Donovan. I realize that the staff is in and out of the studio as these interviews goes on. Are the other two still with us, Ismail?
Yes. Yes, Bryan's here, Dr. Robshaw's here.
Okay, you're listening again. A question for any of the three. Kawasaki syndrome. You mentioned that in your answer there, Dr. Ismail. I'm not familiar with that term, Kawasaki syndrome. What's that?
Hi, John Robshaw. Let me take that up. Kawasaki syndrome is a rather unusual disease seen in children, and it's a feature of it's an unusual thing. Its long name is mucocutaneous lymph node syndrome, and its most important side effect, if you will, it presents as a viral type disease with red eyes, sore tongue, big glands, enlarged lymph glands. But it can cause cardiac damage, particularly damage to the coronary vessels. It can trigger aneurysms, in fact. So I think Dr. Mehr's reference to that was that this virus, this coronavirus, has been triggering rather unusual syndromes. I know there were 20 cases in my home country of children being admitted to the ICU with presumed coronavirus-related illnesses, different to those that have been seen in adults. And I know there's been quite a few cases here in New York, too, in the city, where people have, children of youngsters have needed intensive care as a secondary phenomenon from the COVID. So Kawasaki disease in and of itself is really quite rare. I think I've personally seen it 2 or 3 times in my 35-year career, but it's something we're always vigilant for, same as any serious, unusual illnesses that we see, like meningitis, which we see so very rarely now, I'm pleased to say. We're always vigilant for those kind of quirks of human pathology.
Yeah, and just to clarify, I wasn't trying to scare everyone that now you have to worry about that. My point was that this virus is very, very atypical of viruses. It causes a lot of different things afterwards or during its course, which is not typical of other viruses, especially upper respiratory tract viral disease. So just to find out in line with people are testing positive again, or how long are they shedding? It's just all a lot of unknowns still about this virus.
Yes, and another phrase that you've used in this interview that I had not heard you use before, Dr. Ismail Mehr, viral shedding. If you could explain what that is again?
So that's how long the virus is still active in your body, and basically could be transmitted to others. That's what viral shedding means. It's basically that typically it was thought initially, and on the most part, it's a 2-week course of this virus from the time you're infected till the time you the virus is gone. On most part, we've seen it be 2 weeks, but there have been cases, like you said, that people are testing positive much later. A month later, 35, 37 days later, it could be attributed to that the viral shedding is still taking place. I mean, that's what's happening. The virus is still present, which also means that person could still be transmitting it potentially as well to others. So that's what viral shedding means, is how long the virus is active in the body.
Okay. Now, it's right now, as I speak, it's 5 minutes after 9. Do you have a few more minutes, doctors and CEO Bryan O'Donovan? Getting back to the topic of elective surgeries.
We stopped doing elective surgeries before it was even recommended from the governor. We identified, the university system realized and identified that you need to keep all your resources and ability to prepare for the worst scenario was to stop elective surgery and turn those ORs into ICUs and prepare for that. And then later on, about less than a week later, the governor mandated that, as many governors across the country. It's almost nationwide. I don't think there's any state that was doing elective procedures for the month of April. Starting back up, it's because, like we shared in the beginning, it's safe with the declining numbers here in our region. The Department of Health looked at the numbers from a regional aspect and said it's safe for you to proceed, and it's definitely good, right? It's a good feeling. This is a brand new hospital, state-of-the-art operating rooms, 4K technology for our laparoscopic stuff. I mean, we have new equipment in addition to brand new rooms. So this is why we built this hospital, was to be able to serve the community, to be able to keep surgeries here and not have things go out of town. We have an excellent surgeon in Dr. Adam Basser, Dr. AJ from urology. We have an ENT starting early June. We have another general surgeon, joining us in the end of August. We have Dr. O'Donnell and Dr. Axel in orthopedics, Dr. Naga, who many of you already know, urology. We have pain management starting up. So this is what we built this brand new OR for, is to be able to do these things and keep them here. We're doing laparoscopic colon resections. We're doing some of the state-of-the-art newer procedures. So we're glad to finally start using the operating rooms to do that stuff. It's safe. It's efficient. People coming in are being tested for COVID 3 days prior to the procedure. Unfortunately, the family members and everyone can't come in and be part of the process as typical. We all would like it to be, but it's safety first. The patients will come in. Everyone's masked. Our staff and them, gloved and gowned. We're doing all the precautions for COVID, but we realize that the numbers are down here, so it's safe to ramp back up. So any of you people out there, community members have been postponing that colonoscopy or postponing that knee arthroscopy because, it's just been bothering them when they hunt and they go out hunting and they have a little pain in their knee and they had to get scoped, but we postponed it. Now's the time to come back and get those things done. Because most of you are still social distancing, so that means you may not be going into work right now, and have some of that time. So I think use this time now before everything opens completely up and get your procedures done.
And this question for Bryan O'Donovan. You got a nice donation there from the Hornell Elks Club to help you out with your PPE supply, your personal protection equipment, the masks, and the gloves. How is the PPE supply these days at St. James, Bryan O'Donovan?
Yeah, so first off, I'd like to thank the Elks Club. What a very generous donation to our hospital, as well as, the 50-plus other businesses and individuals that have donated a variety of different things. We sincerely appreciate that and appreciate the support. Our PPE supply is in very good shape right now. We're at 30 days for the most part on hand for all PPE. Again, we work with the university, who has a much larger GPO, and has been supplying us with our PPE over the past 2 months, and has really assisted us with making sure that we're able to protect our doctors, our nurses, and our staff, as well as our patients. So we're in really good shape right now with that, Bryan.
Okay, and is Dr. Robshaw still there? I know the doctors are in and out.
Yes, sir, I'm here.
All righty, Dr. Robshaw, and this will probably be the last question, as I have to let you guys all go soon, and thanks so much for taking time out of your busy day for this. As far as the cabin fever effects of COVID-19 goes, in terms of reasons that people end up in the ER, people maybe, I don't know, falling back into addictions or whatnot. Do you see a lot of that? Steuben County Sheriff Jim Allard was on earlier and here on this on the Newsmaker show, and he was talking about how some people fall back into addiction problems, and he talked about the criminal justice element, how the drug dealers in some cases take advantage of that. Wondering, do you see any cases that you kind of could base on the cabin fever of the COVID-19, or were you, and maybe it's lessening up now as things are improving?
Interestingly, our 24-hour-a-day mental health services have been somewhat less taxed, and our need to emergently treat overdoses, opiate overdoses, of course, we had been seeing quite a flush of over the last few months. Fentanyl, and as I'm sure Sheriff Allard mentioned, fentanyl and other narcotics can kill you within the first few minutes, which is where the widespread access, both domestic and in the hospital, to naloxone, the antidote was very important. But just to go back to cabin fever, even though we seem to be not doing too badly with those kind of folks right now, it's certainly a well-recognized problem that people who have established mental health disease, when they are socially isolated, even diseases like schizophrenia, psychosis, those diseases are made much worse, symptomatically much worse, by isolation. Indeed, the isolation is one of the symptoms of schizophrenia. People withdraw, and if they're forcibly withdrawn from society and social and medical and other contexts, then it's clear that there has been an upswing in some of the reports of psychotic schizophrenic disease simply due to this social isolation requirement.
Okay, we've been speaking with St. James CEO Bryan O'Donovan, Dr. John Robshaw, and Dr. Ismail Mehr. Was there anything I did not bring up that you wanted to discuss before we go?
No, again, thanks. The community has just been absolutely fantastic and so supportive. So, thanks to all of you, and thanks to the community for supporting our doctors and nurses in this hospital through a very challenging time.
Dr. Robshaw, Dr. Mehr, and Bryan O'Donovan, I want to thank you so much for coming on. You guys do a lot of interviews. It's not just with us. And I want to thank you so much for taking time out of your very busy schedule.
It's a privilege. Thank you.
Thank you, Bryan.